Hello, I am Coleen Djouha, a career advising coach at Quince Orchard High School. This is a Meet a Pro interview. This is an opportunity for people to learn all about a profession directly from someone who serves in that profession. So I'm excited to introduce Dr. Theo W. Hodge Jr., MD. We will be asking him a series of questions, and hopefully by the end of this interview, you will learn what it takes to be a doctor. Dr. Hodge, thank you so much for joining me today for our Meet a Pro event.
It
My
is
first question is, can you tell me about yourself and your professional background?
okay. I am Theo W. Hodge Jr., and I am a physician, and I happen to have a specialty in internal medicine and infectious diseases. And so I currently serve as the medical director for a nonprofit organization here in Northeast Washington, D.C., known as the Washington Health Institute. And here I have a very large primary care practice, which has a focus on people living with HIV and also HIV prevention.
Okay, wonderful. What specific education or training prepared you for this career?
So here's the deal. If you want to do what I've done, you have to be prepared for a commitment. So that means graduating from high school first, and then going off to college, usually a 4-year stint. And then while you're in college, you're preparing for the next step, which is 4 more years of medical school. So that means passing all the tests that one must do in order to be able to fill out the applications and get into medical school, and then be prepared and committed to all the work that one must do to complete medical school. And after that comes what we call a residency. That is where you pick which part of medicine you want to specialize in. And in my case, as I said, it's internal medicine, which is essentially the practice of taking care of adults and all of the medical conditions that come about from being an adult, like high blood pressure and diabetes and high cholesterol, and yes, even cancers and HIV. And of course, some of these things and all of these things can also happen as a child, but I specialize in those who are 18 years of age or older. After you complete a residency, which can be anywhere from 3 to 8 years, depending on the specialty of medicine that you choose, and let's say you chose to be a plastic surgeon, that's 8 years. In my case, it was 3 years. After I completed my residency, I actually did a fellowship, and the fellowship was in a subspecialty of internal medicine. And you may ask, well, what's a subspecialty? Well, as I said, internal medicine encompasses all of adult medicine. So there's subspecialties. So that means that you might also be particularly interested in the heart. If you are, then you're going to do a fellowship in cardiology. Oh, you may be interested in joints. If you are, then you'll do a fellowship in rheumatology. That's additional years of work that you're doing. And I must remind everyone that while you're training, you're not making a whole lot of money. And in terms of, okay, let's talk about finances. Well, there's the finances of going to college, and then the finances of going to medical school. So you're paying those 8 years. And when you're in residency, you do get paid, but not a lot. Just reminding you. Now, after you finish your fellowship or all of the training that you intend to do, and then you go and you get a real job, as they say, where they actually pay you more than the pittance that you get paid during training, then, the financials, start to make sense in terms of, okay, I can now think about buying a house or at least paying my rent without worrying about what's coming with the next paycheck. So that's a little background on what I did to get to the position that I currently am in now.
Okay, wow. That's a lot of training. And I'm glad you mentioned that it takes a huge commitment, not only academically, but also financially as well. It sounds like it's a large commitment before you see the payoff financially, literally.
Yes, but I can honestly say it's worth it.
Okay, wonderful. So thinking about your job and your career, tell me what a typical day is like in your job.
So remember, I just mentioned that I serve as the medical director here at my clinic. So for me, my typical day begins first thing in the morning as I'm saying hello to all of my front desk staff and my medical assistants, because for me, I work with a team and it's very important, and part of my job as a medical director to uplift and motivate my team because it is teamwork that gets the patient cared for. And the more motivated people are, the better the care that patient's going to receive. So as I'm walking through the door, I'm saying hello to everyone. And as I finally get to my desk and turn my computer on, I start to refill prescriptions. Yes, people all send their prescription refills to me, and I have to sit on my computer and begin to refill them. And then I also begin to look at requests that patients have. Patients may send me a note via their patient portal to say, hey, Dr. Hodge, my throat is sore. Can you see me today? Dr. Hodge, I was in a car accident and I have back pain. Can you see me today? Or I'm at a specialist you sent me to. You sent me to the orthopedic surgeon, but I forgot my referral. Can you rewrite the referral and send it? So those are the first things I do in the morning. And then at 8 o'clock, that's because I usually get here at least 15 minutes before. So I'm spending that first 15 minutes doing sundry things. But at 8 o'clock begins my first patient. And oftentimes I will be double booked. So I may have a patient coming in for a complete physical where I have to go head to toe and take a history and address any of the problems that they might have. And they may have chronic medical problems such as hypertension and high cholesterol and diabetes. So we address that. And then we talk about anything that's brand new. So that's what happens in the physical. And then I'll usually be double booked with a follow-up. So somebody may be coming in to follow up on their diabetes or hypertension or HIV, or they may be coming in for what we call PrEP. That is pre-exposure prophylaxis, where someone's coming in to review the medications that they have to prevent HIV. So there's a series of things that need to be done. And so I continue that from 8 o'clock until noon. And oftentimes I run past lunch. That's when our lunch begins. It begins at noon. And sometimes I run past lunch because patients are late or they have they have things that I just can't put into a certain amount of time. And so I have to do what I do in terms of talking to them and formulating treatment plans and implementing those treatment plans. It may take me a little bit longer than the time allotted for their appointment. So sometimes I have to, work into lunch, if not through lunch. But most often that I can get my lunch, which begins at noon and ends at 1. And then at 1, the second session begins. And again, I see the same types of patients, new patients, follow-ups, physicals, all those sorts of things. And that lasts to my last patient, which is scheduled usually at 3:30. And after I finish, I sit down. I have the luxury of having a medical scribe. That's a person that can come in. And as I'm talking to my patient, they're doing all the typing on the computer. They're taking care of any of the concerns at my direction that the patient may have. So they're doing their referrals, they're refilling medications, and they're typing everything that the patient has said in terms of history or new problems. Well, I elicit the history by asking the patient, okay, tell me about your knee. How long has your knee been hurting? And is it swelling? Have you taken any pain medication? Those are the sorts of things I do as a primary care provider. And at the end of the day, after I've seen all my patients, my medical scribe and my medical assistant, that's the second person part of my team, and my front desk person, so there are 3 people that make up my team, we all sit down and we go through my schedule for the next day. And that's very helpful, just in case I have a patient, let's say, who is deaf, and I need to arrange for someone to be here who knows ASL. So that's why, doing these huddles, as we call them, can be very efficient in actually helping to take the best care that one can of the patient. And after that, I'm here, as you can see now. Typically, I am responding to phone calls. I'm closing notes, meaning I'm completing the notes that the medical scribe has set up for me, and addressing emails, because patients, again, they can communicate with me via the patient portal, which is electronic, or they can communicate with me via telephone, which means that I'm happy to check voicemails, or they can send me an email that is outside of their electronic medical records. So they have multiple ways to access me, and I have to take the time to go through all of those different modes of accession to be sure I haven't missed anything. So oftentimes, I get out of here a little late, although I've gotten better since I now have a medical scribe, so I'm not spending as much time closing notes because they're essentially closed for me. And that's a typical day here.
And wow, what a day it is. And it seems like you would have different, I mean, each day can bring different patients with different issues. So you just never know what you're going to encounter. So thank you for
Never a
sharing that.
boring moment. Never, ever.
Never a dull moment. I bet. I bet. And I'm glad you mentioned this, because that kind of bridges into my next question, is how you stay flexible and adaptable in the face of unexpected obstacles or setbacks.
You must always be flexible here. If you were inflexible, you would go crazy. It just is not going to work. You have to recognize that, patients arrived late. They were in traffic. And so your schedule's thrown off completely because they're arriving late, and you have a schedule. So you end up seeing whoever is on time, and then you squeeze them in. And, there are policies that people have that if you're, late by a certain amount of time, you have to reschedule the appointment. I don't do that. I'm like, okay, if you made the effort to get here, unless you're being completely disrespectful and just trying to be late, which is never the case, then I will take the time to see you. I mean, we'll squeeze you in. You have to understand you have to wait, but flexibility around here is an absolute must. And my staff and my team recognize that you have to be able to roll with the punches. You expect one thing to happen this way and it doesn't. So you reassess, you come up with a solution, and you offer it to the patient, or you actually begin implementation of that solution. So that's what it's all about. And that's what one must be in order to be an excellent healthcare provider.
Very good advice. How would you explain your job to a 6-year-old, like an elementary school kid? How would you explain what you do?
It's easy. Patient broke, me fix. So- and that's as simple as one can make it for
Okay.
a 6-year-old.
Patient broke, me fix. Okay.
Exactly.
All right. That is good. Okay. All right. And my final question is, speaking to, middle and high school students, what type of advice would you give them as far as like classes to take, things to get involved in, any internship, apprenticeship opportunities, things that they can be doing now to prepare for getting into the career of a medical doctor?
So if you have any relatives, like you do, that can actually offer a shadowing experience, because I definitely have had patients who were not medical students yet. Usually this happens for my medical students, where they shadow me. They get to go in the room with me when I see patients, and they understand they're to be, like a statue in the room, but they get to see me interact with the patient. They get to see how the patient interacts with me. They get to see the reality of sharing your vulnerabilities and medical concerns with the doctor, how the doctor responds to it, how they create treatment plans, and the patient's response to that. All of that is wonderful. So I would certainly, if they have relatives who are in the healthcare field, to ask them if they wouldn't mind shadowing them. If they don't have relatives, then what I did when I was in college, and this is also something one can do in high school, was go to the local hospital, and they used to have what we call candy stripers. And I don't think they have them anymore, but they still, I'm sure, have some type of volunteer program where you go in the hospital, and the hospital will have these programs where you can either shadow a physician or have some type of interaction in the health field that would give you some idea as to whether or not this really is right for you. So I think the best thing would be if you could shadow someone. I mean, if you have a primary care physician, I mean, for kids in the 8th grade, they still are working with their pediatrician. So they could ask their pediatrician, hey, doc, how about I show up here and see this whole doctor thing? Do you mind if I follow you around? I promise I'll be a statue. You might be surprised at the answer that you get from your pediatrician.
Okay, wonderful tips. Thank you so much for taking the time to speak with us, and we appreciate you spending your time with us, and MoCo CAP and WorkSource Montgomery. Certainly appreciate the time that you have taken to answer our questions. Thank you very much. Have a good evening.
Thank you. It's been a complete, absolute honor.